You know that last week the inquiry has heard from Professors Marmot and Bamborough, who told the inquiry that changes in the social determinants of health because of austerity since 2010 were likely to be the causes of the adverse changes in health and health inequalities in the UK. Government policy had an effect on health and social care, which meant that those in the worst situations of society were disproportionately affected when COVID hit. And secondly, that was identifiable, it was predictable, and it should have been part of the government planning.
I just completely reject that. And in the case of the Marmot and Bamborough report, and obviously there's a lot of very interesting work on health inequalities, which we did a huge amount to seek to address. They have this statement of paragraph 151, national economic wealth, i.e. GDP, has long been considered as the major global determinant of population health. Of course. In other words, that's what happened. Britain had a huge economic crash, the greatest since the 1920s and 30s Great Depression. And of course that had an impact on poverty in the country. It would have been worse, in my view, and in the view of many other people, including the Governor of the Bank of England at the time, Mervyn King, had we not then also tried to address the risk to the public finances, because that would have led to a fiscal crisis, like you saw across much of Europe, that would have meant even less funding for these public services. We tried to protect the health service during that austerity programme.